In this tape, we'll be demonstrating the closed method of canine castration. A closed technique can be used for any size dog as long as it's performed carefully. The scrotum has not been clipped. This could lead to self-trauma. The testicle is pushed up and over the urethra into the prescrotal area, and an incision is made over the testicle. You can see that it's pretty important to stabilize the testicle underneath the skin, as the skin is very difficult to tense. Many dogs will have this collection of fat right over the top of the testicle. And when you see that fat, you know they're at the right level for closed castration. The testicle has been pushed out through the incision line, and now we're using a sponge to tear down the ligament of the tail of the epididymis. Once this ligament is torn down, we continue to strip around the base of the cord until the cord has become long and narrow. This cord is small enough that 2 encircling ligatures could be used for ligation. In a larger dog, transfixing sutures would be necessary, and so the index finger is inserted in the back of the cord. This forces the cremaster muscle to separate itself from the vessels, and the needle can be passed between the cremaster and the vessels. Depending on the size of the dog, we'll either be using 2/0 gut or 0.0 gut for our ligatures. Here we'll demonstrate a transfixing technique. The index finger is separating the cremaster muscle from the vessels. The needle is inserted in the space between the vessels and the cremaster, and it's pulled through. The ligature will be tied on the vascular side first. We'll be using 2 throws on the vascular side, and then passing one end all the way around. And tying 4 throws or 2 knots on our encircling ligature. Because this is a smaller dog, we're going to use a second ligature as an encircling ligature. The testicles can get very sticky, so try and keep them moistened with saline to improve your ease of handling. Here the surgeon is doing a 2-handed hand tie and ties 2 knots to ligate the cord. We clamp the cord to prevent blood from coming back out as we cut it. And we'll be using our Mayo scissors to cut the cord. Hold onto it with your forceps and examine it for bleeding, and then release it. The same procedure is repeated on the second testicle. The testicle is pushed up into the incision line and stabilized with the hand. The layer of fascia over the top of the testicle is incised. And the testicle is held tight up against the incision line to expose the remaining tissues that need to be incised. Sometimes it takes both hands to get the testicle out of the incision. Here we're going to break down the ligament of the tail of the epididymis again. We're stripping off the fat and exposing the cord. We keep the cord moistened. And once again, if we're going to transfix, we place our index finger behind the cord and separate between the vessels and the cremaster. In this case, the cremaster is on the right and the vessels are on the left. One knot is tied on the vascular side. Notice that a surgeon's throw is not necessary. Then the ligatures are wrapped around the testicle. And 2 knots are thrown on the opposite side. Clamp is placed on the cord, and the cord is cut. We examine it for bleeding and then release the cord. A 2-layer closure will be performed. The first layer will be subcutaneous tissue. We'll use 3/0 Dexon or 2/0 Dexon to perform this closure. The subcutaneous tissue on the edge of the incision is picked up on either side. You can grasp tissue in the middle, however, the urethra is lying right underneath. So make sure if you do pick up tissue that it's very thin and does not contain the urethra. In small dogs, a simple interrupted suture can be used. In larger dogs, a cruciate suture may be necessary. In this case, the surgeon is using 3/0 PDS for closure. Notice that the tissues are gently opposed, but not necrosed. The next layer can be closed by either skin sutures or an intradermal closure. Intradermal closures can be challenging because these incision lines are very small and the skin is very pliable. The closure is buried by going deep to superficial and then superficial to deep. The suture is pulled lengthwise to bury the knot better. You may have to handle the skin with this closure because it is so pliable. Very few bites are needed before you reach the end of the incision line and you need to tie your knot. In some cases, a single interrupted intradermal suture will be sufficient. Now we're going to close by burying the knot. We've made our first loop by going from superficial to deep and then deep to superficial. We'll then take another bite from superficial to deep, so all ends are buried. We'll pull lengthwise so the knot buries better. 4 throws are all that are necessary for an intradermal pattern. If the knot doesn't bury well, then the loop end is cut off. It should be cut off fairly short. The needle is reloaded, and it is passed just behind the knot. It should be passed between the incision sites, between the sub-Q layers, under the skin, and out the skin. It's then pulled down and it's cut off. Et voilà!